Welcome. You're listening to the Leading Health Podcast by the Kansas Health Foundation. We have a bold vision to make Kansas the healthiest state in the nation. And it's not just a vision, it's a movement powered by people like you. You are one of the 30,000 Kansans invited to help us shift our state's future. We're your hosts, Ed O'Malley and Susan Kang.
In each episode, we move beyond the usual conversation about health, the doctors and deductibles. Instead, we talk about capital H health, our ability to thrive. This is your invitation to grab the Leading Health book and join the conversation as we work together to make Kansas the healthiest state in the nation.
Hello, welcome to the first episode of the Leading Health Podcast. My name is Ed O'Malley. I serve as president and CEO of the Kansas Health Foundation. This podcast series is all about this book, Leading Health, How You and 30,000 Kansans Help Communities Thrive. And throughout this whole series, I'm going to have my colleague, Susan Kang, with me. Hello, Susan.
Hi, Ed. How are you?
I am fabulous. Thank you. Susan, of course, you serve as senior advisor here at the Kansas Health Foundation. You have a long history in health in Kansas, and we've worked together for a long, long time in different capacities. I'm really excited to get this podcast going with you. We're going to have a good time.
Me too. I'm really excited about it.
You know, the book was a big nutty idea of the Kansas Health Foundation, right? Let's create a book that makes the case for why health matters in Kansas, why we need to rally around health in Kansas. The book introduces some different ways of thinking about health. We'll get into that later. But the book is a massive project of the Kansas Health Foundation. And then we had this idea of let's create a podcast to be a companion to the book, knowing that some people might come to these ideas through the podcast, some might come to it through the book, but here we are. The podcast is becoming a reality now.
Yeah, well, I love that we're starting the podcast. I'm really excited about bringing to life the themes in the book and some of the real big takeaways that are different than the usual way that we think about health. And so I'm kind of really excited about digging into that. And, and I really invite the listeners to, maybe join us throughout the whole 21 episodes that we're going to have, right? One for each chapter in the book. And hope that, they get as excited about this as I know we are.
We are very excited about it. You and I have never co-hosted a podcast together, but we're going to have a good time doing this together.
Well, it's my first time
ever. It's going to be fabulous. And one thing that I'm excited about is the book was written to be very accessible. It's very short. It's a very quick read. As you know, we wrote it that way on purpose. We wanted this to be a resource for Kansans, especially the 30,000. We'll talk about the 30,000 later. Right. But we wanted this to be a resource for Kansans to help them make more progress on things they care the most about, which we know those things all connect to health the way we define health, right?
Yes.
The things that Kansans who are involved in their communities, who are serving on city councils, who are on the school board, who are community-minded business people, the things they're working on connect to health the way we think about it. The book is a resource for them, and this podcast will be as well. I know we're going to talk in a little bit about the first chapter, but we'll set that up here in just a minute. Let's stay on the book for a moment. The book has 3 parts to it. And part 1 is really about the state of health in Kansas and what's happened the last 30 or so years. By the way, listeners, it hasn't been great what's happened. More on that to come. Part 2 of the book is really the surprise. It's like, surprise, it's not a health challenge, it's a leadership challenge, and here's why.
Yeah.
And part 3 of the book is really the prescription, right? So if part 3 is here's what we need more Kansans to do. So we're going to cover the whole book during these 21 episodes, and it's going to be a resource for people and fun for you and me and for the guests we're going to have on. But we're approaching guests a little differently. So we're calling them conversation catalysts. And maybe we should talk for a minute as to why that's what we're calling these guests we're going to have with us. Why does that feel important to you?
Well, I think they're conversation catalysts because they're going to help us to see how some of the themes, some of the points that are made in the book can come alive and how they've been applying some of those themes, I think, in the work already. all toward helping us, honestly, lead the nation in health. So I think that'll be really interesting to hear from the guests who are in all different aspects of life, not just healthcare, but, health writ large. And you're going to find out more about this, which I'm really excited for you to find out more about. So I think the guests will help us to bring to life some of the points that we're trying to make in this book.
Yeah, and so there are 5 conversation catalysts, and so the listeners are going to get a chance to get to know these guests. So it's not like a one and done. It's not like there's one guest and then we never see them again. And the point of the talking to that guest is to learn all about their story. No, the point here is these 5 guests will be joined by one, and most episodes will be joined by one. Today it's just you and me, but future episodes will be joined by one of those guests. And the point is for them to help bring to life the chapter. And these are 5 great people. Full introduction to come on each of them, but they're 5 amazing Kansans who are each involved in different ways in making the state a better place.
I'm excited to talk with every one of them.
We're going to have a good time. Anything else on the overall book or overall podcast series, Susan, that we should make sure we land before we get into today's topic?
No, I think this is a good start. I think we can be digging into the book now.
Okay, tee up the episode today then, the chapter today we're talking about.
So this chapter really illuminating sort of the difference between lowercase health with a small h, and health with a big H, so uppercase health. I love how we start the book with an example of you going to the University of Kansas health system and having the experience that you did. And I want you to talk a little bit about that. And you also talk about sort of the up and to the right metric and what that means.
So the book starts with the story of me driving back from the University of Kansas health system, their main hospital in Kansas City, Kansas. And it was this amazing day. And it's basically like a field trip. Like they put on this kind of day-long field trip experience for about 10, 12, 15 Kansans at a time. Yeah. And they're handpicking these Kansans. And there are some elected officials. There's some prominent business people, folks like that are being invited. They're coming to the main campus for a day. The point of the experience from the health system's perspective is to showcase the University of Kansas health system, like showcase what they are capable of. And by the way, it's an amazing health system. I'm biased because I've been connected to it for a long time, but it is an incredible turnaround story. It was one of the worst hospitals in America 25, 30 years ago. It's now one of the best. So it was an incredible day. But I'm driving back and I'm reflecting on the day, and I'm reflecting on all the things I learned. And it was incredible. Like I got to be on the helipad when a stroke patient, a pretend stroke patient, but it was like a simulation. It felt very real to me when a stroke patient landed and then was wheeled to the operating room, the special stroke bay, where they were able to go in and take a blood clot out of the patient's brain. And I'm right there like bedside for that. And I know it was a simulation, but it felt real to me.
Yeah.
And I was sweating and I was nervous and it was incredible. Or other things like the emergency room, right? Being there, and we learned all about how they deal with trauma victims. And, unfortunately, the number of trauma victims keeps increasing.
Right.
And in fact, they had to increase the size of the emergency room recently, this massive renovation, which was a beautiful space, and those doctors and nurses and professionals and patients need that space. But it was this amazing day. And anyway, I'm driving home and I'm thinking about it all. And one thing I remembered was that every stop along the field trip, the doctors we were talking to, in essence, were telling a version of the same story.
Yeah.
That everything is going up and to the right. Like that on a graph, like that means it's getting worse.
Right,
like there are more stroke victims every year. There are more trauma victims every year. There are more cancer diagnoses every year. And one thing I did during that day is I asked everybody I talked to, like, why? Why are things going up and to the right? Why are there more cases of everything? And what they said, in essence, was they talked about the environment. They talked about the world that people are living in, the choices that communities and people are making. With the cancer diagnoses, yes, genetics can play a little bit of role, but the huge surge of cases, the doctors were saying, in essence, is because of like the environment and the choices people are making. It just got me thinking about how little health care has to do with health versus all these other things that create or contribute to the environment where health takes place. Does that make sense?
Yeah. I mean, I think most people think sometimes, especially with things like cancer, that it's just genetics and you can't really do anything about it. But we do know that there's research that indicates that that's only one component.
Yeah.
Right?
Yeah.
And it really is the environment. So I love that you're learning more about this directly from these doctors who are talking about the environment too, not just about the procedures that they're doing.
Yeah. And I wrote this part in the book. Most attendees left that experience impressed and confident about treatments available at the hospital. I left worried.
Yeah.
I fear our admiration for brilliant healthcare professionals is distracting us from understanding why our society needs more and more of their brilliance. I fear our enthusiasm for what we can heal is blinding us to what we can prevent. Yeah. It was kind of a big aha. And by the way, those doctors are amazing. That health system is amazing. I am so thankful that is here in Kansas, but I did leave feeling like there's a whole bunch of things have to be done before you ever get to a healthcare facility that impacts health.
So Ed, what does it really mean for someone to be capital H healthy?
Yeah, that distinction is so important. And I really like the way we talked about it in the book. What we said in the book is that health with a capital H is your ability to thrive. Lowercase health is part of capital H health, but only a small part. We went on to say health, capital H health, is everything. It's your kids becoming successful, your grandkids enjoying happiness, friendship, and love. It's the ability to control your destiny. It is agency over your life. Health, lower H health, is healthcare, is sick care. Health, capital H health, is your ability to thrive. That's what we're getting after.
Yeah, which in essence led to the writing of this book, right?
Yes. Yeah. So here we are at the book, the podcast, and everything else. And ultimately, I think what we're getting at, especially with this first story that we highlight in the book, is that the up and to the right graphs, we're not going to solve that problem by waiting till somebody has a stroke and fixing the stroke faster, right? The up and to the right, like the healthcare professionals are going to deal with that the best they can. But we, people who are involved in our communities, people who care about health, people who care about communities thriving, we have to work harder and smarter and more strategic to figure out how do we create the conditions for health in the first place. It's a big mindset shift.
It is. It is a big mindset shift. And I think it's really, really important to talk about. And the way we do this in the book, right, is to distinguish between lowercase h health and capital H health, right?
Yeah.
So talk a little bit more about the distinctions between the two concepts and why it's so important to know that distinction.
Yeah, and we just made that distinction up, but we felt we needed some way to help people, some interesting, maybe a slightly provocative way to help people distinguish between health and healthcare. Mm-hmm. And you and I both worked at the Health Foundation for a while now, and we both had so many times where we tell people we work at the Kansas Health Foundation, and they assume we work on health care,
right,
or that we are in health care. And we're not. We love health care, but we don't spend our time most days talking to doctors and nurses and hospital administrators, and we do some of that, but we have a much broader way of thinking about health. And so in the book, we introduced this idea of capital H health versus lower H health. Mm-hmm. And lower H health, we're asserting that's health care, which, by the way, is usually sick care, right? Most health care happens once you're already sick.
Right.
Capital H health, uppercase H health, we're saying that's everything that goes into your health. right? That's everything that makes up, that's your ability to thrive. That's the quality of your neighborhood. That's public safety. That's the quality of education that your kids are receiving. It's economic opportunity. In some other places, they would use the term, it's the social determinants of health. We didn't necessarily use that term in the book, but that's what we're getting at with capital H health. It is much bigger than health care. And we're really trying to land that early in the book, aren't we?
100%. I think that's really, really important because I think most of us don't really think about all the other things that go into health, the capital H health, right? I mean, so like, for our rural friends, if you don't have access to cable, right, the fiber lines, and you can't have a telehealth, appointment, that is part of big H health.
That's a great example. Right. So broadband access is, in essence, a part of big H health. I love it. And not only because of something like a telehealth appointment, but also just it's because of things like it's hard to be entrepreneurial and start a small business and provide for your family if you don't have access to basic technology. And not every place in Kansas, frankly, has access to broadband in the way that we do here in urban areas.
Right. And something like transportation. If you don't have mode of transportation, normally people wouldn't think about transportation as being part of big H, but, we're saying that it is. That's all part and parcel. That is part of the health being everything, right?
Yes. Yeah. We're trying to land this idea that health is bigger than health care. That health is inclusive of so many different domains beyond healthcare. And we start to break some of those down in the book. But it's things like your economic status.
Right?
We know your economic status is the biggest determinant of your health.
Right. Your zip code, where you live, right?
Oh, okay. Yeah, it's geography. Right. So we talk about that in the book, that it's geography, that zip codes matter. Like where you live matters. In fact, we talk about how the lifespan difference in Mission Hills versus Argentine. But those two parts of our state are just like literally a few miles apart. And in Mission Hills, the lifespan is 86.7 years. In Argentine, just a couple miles away, it's 75.1 years.
Yeah.
Right? Now, we're not saying that's a simple thing to understand. There's a lot of factors that go into that. But geography is a part of health.
Yeah.
Right? And we have other examples of other zip codes where those life link discrepancies exist. So it's a big thing. So we're trying to land that in chapter 1. Okay. This whole podcast series is going to be talking about capital H health, not just lower H health. We're going to be talking much, much, much more about capital H health than we are about health care, lower H health. So we need to make sure people understand that in this first episode for sure. What else do we need to make sure people understand?
Yeah, our health status, right? I know we're going to talk about this in another chapter. I think it's going to be chapter 3 where we talk about the America's health rankings. But, one thing we do know is that status of health in Kansas has been declining over the last 35, 36 years.
Yeah.
Right?
Yeah.
So one of the things, since this book is about the 30,000, it's geared toward the 30,000, right? Who is really actually responsible for improving our health and getting us back up to where we were, much higher in the health status?
Yeah, I think
many years ago.
I think that's a big thing we're trying to land, right? We're trying to land the 30,000, which more on that to come. But in essence, the 30,000 are the movers and shakers of Kansas.
Right.
The 30,000 are the people who hold authority in their communities. Right? Elected official, prominent business people, pastors, rabbis, university deans and presidents, school superintendents, right? So the 30,000, we're not saying they are fully responsible for all aspects of health in Kansas, but we are saying that they have outsized influence on health, capital H health, and they create the conditions often that allow people to make healthy choices or not. And we need the 30,000, those types of Kansans, to realize they've got a role to play. And we need them to play it really, really well. And that's really what the book is all about, is helping them see the problem, helping them see their piece of it, and helping them know how to do their part to move it forward.
Yeah, and the rest of this book, I think, helps us to figure that out, right?
Yeah, I think by all means. And it starts with, though, getting people to, one, think about health, capital H health, versus health care, lower H health. It also starts with recognizing that we have fallen in the health rankings. We'll talk more about that later, but the quick story is we used to be one of the healthiest states in the nation. We fell as low as number 31 a few years ago.
Yeah.
Right? We're trying to turn that around now, but no state has fallen further.
Yeah, that's
in the
really
last 35
distressing,
years
right?
than Kansas.
That's really distressing
in
to
these
hear.
rankings. We'll explain the rankings, where they come from. We'll get all into that in episode 3, I believe.
Yes.
Okay, so that's coming, listeners. But I think it could be useful to just mention, we write about this in the book, but we talk about this kind of definition of capital H health from the World Health Organization.
Yes.
And I think it's good. So I just want to read it. The World Health Organization defines health, and we put the capital H on that word health in the book, defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So like that experience at the health system I was talking about, it was amazing, but it was all about treating disease or infirmity, right? I love that we have that, but it wasn't about this complete physical, mental, and social state of well-being, which is what we're really after with this capital H health.
Yeah, that's the ideal way, I think, to approach health.
Yeah,
right?
Yeah. And so I think one thing that we're wanting listeners to think about during this series is, yes, we believe in personal responsibility. Yes, we believe that people need to make healthy choices, and that if they're making unhealthy choices when healthy alternatives exist, that, shame on them. Or another way of thinking about it is, if the playing field is level, if everybody has the same playing field, if the barriers have been knocked down for different people and the playing field is level, then somebody's health is kind of up to them and their own personal choices. But if the playing field is not level, if some groups have more barriers or hurdles to a healthy life than others, then the 30,000 have some work to do. And helping them think about what is that work and how do they do it is what we're going to be exploring.
I love that. I think that's really, really important. And with the idea that in the end, people who live in the Argentine neighborhood will have the same
Opportunity.
lifespan and opportunities as the people in Mission Hill, right?
Yeah.
What you referred to earlier.
Exactly. It's one of those things like we can't guarantee the exact same outcomes for everybody, but we should be able to say everybody has a fair shot.
Yeah.
Right?
Yeah.
The playing field is level.
Yeah.
And we're not there yet. We're going to explore that over the course of this podcast series. We're going to have some fun while we do it. We're going to learn from some great conversation catalysts. And ideally, the book and the podcast, the point behind both of these things is to help more Kansans focus on this idea of capital H health and help us rally the state to once again be one of the healthiest states in the nation. I think we can pull it off, don't you?
Well, that's why I'm at the Kansas Health Foundation, because I think that we could pull it off.
By golly, we better. I love it.
So there we are. Thank you, Ed, for a great conversation. I really enjoyed it. And I hope the listeners who are out there right now, I hope you enjoyed it as much as I did. And we look forward to seeing you at our next episode, when we are going to specifically focus on the 30,000 and health, capital H health. Before then, this is what I encourage you to do. For each of you out there, figure out what your connection to capital H health is. Thank you, and I look forward to seeing you for our second episode.
Thanks for listening today. Before we leave, there are a couple ways you can help. The first, visit kansashealth.org/leadinghealth to claim your copy of the book and join in the efforts as we work together to make Kansas the healthiest state in the nation. The second is to share this podcast with your network. Also, we'd love to hear from you. Drop a comment from whatever platform you use to get your podcast.